Okay, our recording is on. Good evening, everybody. Just for the record, this is the 176th meeting of FOSWL, and may I request Dr. Ravi Rao to read the prayer.
Every FOSWL meeting is commenced with a prayer, and we have always used the poetry or poem of Mr. Rabindranath Tagore, famous literary giant and a Nobel laureate, from his book of Gitanjali. It's called Heaven of Freedom. I'll read it out. Where the mind is without fear and the head is held high, where knowledge is free, where the world has not been broken up into fragments by narrow domestic walls, where the words come out from the depth of truth, where tireless striving stretches its arms towards perfection, where the clear stream of reason has not lost its way into the dreary desert sand of dead habit, where the mind is led forward by thee into ever widening thought and action, into the heaven of freedom, my Father, let my country awake. Thank you.
Thank you, Ravi, for also a little bit of introduction. Ravi is a very dear and old friend. We've been family friends for over 30 years. He retired as Director of Quality Assurance from Warner Lambert. It was earlier known as Parker Davis. So he enjoys his retirement in Secunderabad, between Chicago and Secunderabad, I guess, where he visits his other daughter there. So today, as I said, we have a very, very accomplished, energetic, and young doctor, a practicing dentist, but she's not restricted herself to just clinical practice. After doing her BDS from A.B. Shetty Memorial Institute of Dental Sciences in Mangalore, she continued to do her MD, completed her MDS in KLE's VK Institute of Dental Sciences. And currently, she is enrolled for her PhD in Jaipur, Jaipur Dental College. And she is also an associate professor in Mahatma Gandhi Institute of Dental Sciences. Now, as if this were not enough, she has also co-authored a book on dentistry, and she is a sought-after creative medical writer for, how do you pronounce this, Aishwarya? I can't, it's a tongue twister.
It's
Synapse?
Synapse. It was
Synapse?
it's platform or social. It was an app-based thing where they wanted to be an intermediate between the doctors and the patients. So
Patients.
basically, yeah.
Right.
So
So
on
she is
digital.
quite active in that, and she has co-authored coaching books for prospective dentists and dental aspirants, I would say, who want to pass. So that is Dr. Aishwarya Rajeev for you, and she's going to speak to us on something which I think is very relevant to most of us, if not all of us, in the sense that very often we take dental care for granted. It's become a part of our daily routine in such a way that we don't really pay conscious attention to it. But over recent weeks, I've been learning the profound impact or consequences that lack of oral hygiene can have, especially in senior citizens. I mean, some of those things are, I wouldn't have even thought of. So I'm sure it'll be a very interesting talk, and she believes in a very interactive mode. So she's going to make her presentation first, and then we'll have time for questions. And as usual, please save your questions for later. Type them into the chat box. If some of you have downloaded the new version of the Zoom app, the chat has moved from the bottom pop-up screen to the right. At least that's the way I'm seeing it on my desktop. If you're on a phone, it may not have changed. So type in your questions as the talk is going on, and we'll pick up as many of them as we can. Dr. Aishwarya, may I invite you to share
Thank
your
you.
screen and
Oh,
start
yeah.
your presentation.
Okay, I will. Is my screen visible to everyone?
Yes.
Um, Good evening, everyone. I'll be talking about aging gracefully and how the whole idea of this is bringing awareness for the elderly on how to take care of their teeth, especially in order for them to at least maintain their oral hygiene and also see that the longevity of the teeth they're able to maintain. Okay, um, so normally this is a separate branch of dentistry that a lot of Indians don't take much emphasis on because normally when you're younger, all of us know that we have two sets of teeth. That is your primary teeth, that is your milk teeth. And once you lose them, then you have your permanent teeth. So most of us are under the assumption, right, that once the teeth are there, like we don't have much need of taking care of them. And a lot of people take their teeth for granted. And that is something I wish most of us realize that teeth, when you eat, when you speak, the importance of your teeth is very important in that because the whole the mouth as a functional unit helps you from your nutrition to your speech to your personality, everything. It plays a very vital role, but people take that for granted. And then when you take it for granted, especially in your middle year, right, at the old age, you start to see a lot of changes in your body. And unfortunately, it even impacts your teeth. So, and by that time, some people do not know how the damage has progressed. So, in order to prevent it, it will be better that, you are at least aware of the changes that happen. So this one branch, which is called geriatric dentistry, unfortunately in India, we haven't had a lot of, we've not had a lot of people who actually come out and, actively, you take care of this branch. And it's not there in the curriculum as such. So basically the age as what we see, right? People generally above the age of 65 are considered as elderly, and this is just a basic statistic that I'm just putting in front of you guys. So this uh, any person above the age of 65, we would generally see that patient as somebody who we would see as an elderly patient, and we'd give oral care which would be a little different than what we would give to somebody who's young or somebody who is in their middle age. Now, for us to understand a bit of what happens, right, we need to know that there are certain parts of the tooth. You have the enamel, that is the outermost layer that you see here. This is the enamel, and this part is the enamel, and this is the hardest substance that you have in the body. And underneath that, you have the dentine. The interesting fact about enamel is once you lose your tooth enamel, you can never get it back. So that's why as you age, right, especially you have only two dentition. So once you lose your milk teeth, then you have your permanent teeth. And your permanent teeth come into your oral cavity at the age of 18. So imagine from the age of 18 to your late years, you only have one set of teeth. And if enamel gets eroded over time, you cannot replace it. So, and especially if you have dental caries, that like normally if you have any cavity in your teeth, so that's why they restore it with the cement. Because if you don't do that, then it will proceed further. The destruction will go from the upper layer here, then it will go down to the dentine. So once it goes from the enamel and dentine, and once it's touched the pulp, then the vitality of the tooth gets compromised. Because if you see here, you have only one way the blood vessel enters. That is to the root, the base of the root. And if this gets compromised, then you have a source of infection and it will actually seep into the bone. And then you might have an infection here. So in order to prevent all that, it would be better if you have, one though you should do a preventive measure where you should actually see that your diet is non-cariogenic, which I'll speak a little more later. And then if you have an initial caries, it's better to fill it off here. and then maybe here. And if there's a root canal, getting it treated then and there. If not, if the infection sweeps to the bone, that is your within your jawbone, then mostly you can still save the tooth. But if it keeps on going, then the crown structure keeps on breaking, and then you have only the root left. And then the only thing that you can do that time is extracting or removing the tooth. So each stage there is still a chance for you to save the tooth. So it would be better to do it at the initial stage. Now, like I said, like if you can see this, right, in this image here, so this is the enamel. Here you can see there's a lot more enamel, but with grinding. So especially some people, they have this habit of night grinding. So people who have stress, people who have some sort of a physiological habit, so they keep on grinding their teeth like this, especially athletes. So, or people who have like are in high stress jobs. So this, if you see, this is the enamel on top totally gets eroded. So in order to prevent this, one is you need to know whether you have a habit, and if you do, then you should go to your dentist and you have these occlusion night guards. It's basically a tray that you have to keep and sleep with, so that prevents you to grind your teeth. So coming to the changes that you see, the first change with age, since you have your teeth for so many years, that is like from the time you're 18 to your old age, you only have one set of teeth in your mouth. So definitely they will have wear and tear, right? So this generally, you can see that the enamel gets lost. And enamel once lost cannot be formed again. So once lost, lost. And because of this loss, so the dentine below it is a little yellowish. So you can see, and also sometimes what happens is when you have too much chai, you have too much coffee, you have too many colored food in your colored substance in your food, your teeth absorbs the color and it becomes darker. It takes a different shade depending on the coloring agent that is there on the food. So these are the changes that get more pronounced as you age. And dentine also. So there is still a debate about some people say that if there's an initial trauma, dentine can be the underlying substance, underlying layer after your enamel, like we saw, is the dentine. Some people say that it can be regenerated to a certain extent. So this regeneration would be your secondary dent, like would be a little bit of your reactive dentine that is formed, and a part of it only can be replaced, but generally it is not. So that is one thing. And then the pulp. So the pulp, as we saw in the previous thing, so this is the channel from which your blood from the base comes up. So as you age, this space gets narrower. So there is a more chance that the nutrient supply to your tooth also decreases. So these are the main changes that you see in the tooth anatomy. Get stuck for a second.
You can close the PPT and open it again and then share it.
Yeah. Yes, uncle, I'm doing. I don't know why it's stuck over here.
You just close that PPT. reopen the file and then share it again.
For some reason on that one. Sharing another. Am I audible?
Yes.
Okay. No, why the screen is just frozen. Oh, I think I got rid of this. Sorry about this. I will start again. I will
Yeah.
start your laptop. Is there any doubts in this so far? Like, do take at the end also?
Sorry?
I'll just, if there's any doubt, the doubts will be at the later stage.
Later, yeah, at the end of the.
Okay. So I think I'll not put that slide share and I'll leave it at this so I can just change.
Yeah.
Let's see, I hope it should not, that's fine. Okay. So, so right now we know the parts of the tooth, right? So there's the enamel, there's the dentine, and then there's a pulp inside. And a lot of people don't realize that normally this is where your tooth is on the outside. But when you have to see it within the jaw, it is within the bone and it is attached via two structures, and out of which the cementum is a very important area. So you don't have enamel inside the jaw. You only have enamel outside. So it ends here. And within the jaw, you have the cementum. So as we age, what happens within the cementum also, you can see a lot of calcifications, and these are cementicles. So these actually can, if they are formed within the pulp, right? So the blood supply to the pulp can stop. So that also could lead to a death of a tooth. And that could also be a reason for an RCT. A lot of people actually that we've observed is right, especially when somebody tells them that, you have to get a cavity filled. A lot of elderly patients have a little bit of fear getting it done because they assume that, dentists generally are doing it for the sake of this, like some cases, the apprehension is real, but in most cases, when the cavity is at the initial stage, it is always better to get it filled. And also, if an RCT is suggested, please don't delay it, because as you can see, all these changes are real. And the more you delay it, the more it will affect the longevity of your tooth. And if you lose the tooth, then you will not be able to eat properly, you'll not be able to speak properly, because there will be gaps around here and there, right? So whenever you eat, that if this now suppose here you can see the tooth is missing. So what happens is food can get lodged here. And if the food gets lodged, eating would become difficult. And then this also could cause damage because there is a space here. If you do not replace that space, then this adjacent tooth will also have a chance of getting an infection, because it's just a place, there's a small pocket over there that food can get, stored in.
Is
So,
just to interrupt you, is RCT root canal treatment?
yes, root canal treatment. Yes, uncle.
Okay.
I'll say root
Yeah,
canal.
yeah.
I'll explain if anybody has more doubts. I will explain the whole procedure of a root canal, because I think a lot of people, like, generally when you go to a dentist, tooth cleaning is what they generally most of the people go for a tooth cleaning. or else they go for filling.
Right.
So these two things I will at the end I'll explain why is it important and why doing those two things you can actually prevent most of your dental treatments, the future ones. And so there is a very interesting thing, right? So I don't know if most of you have noticed that as you age, you have like back in the day, people used to not know the importance of implants, and they used to use dentures, right? So if you use dentures, what happens is it does not mimic. Now, if you can see this tooth is within the bone, right? So it anchors within it. So it prevents the resorption of the bone. Whereas if you lose the teeth,
Stuck again?
I don't know. I think whenever I write, uncle, I think that's why it's causing an issue.
Oh, when you're writing on that? Okay.
Yeah. No, I think now it's fine. So is it seen, the screen?
No, you have to share it again, I think.
I think, like you said, the new Zoom, no, it's a little new for me also handling this because I prefer the old one. This one
Yeah,
is
they changed quite
it's a
a bit.
little, yeah. So it is a little complex because by the time you figure out now,
Right.
so well, it should not be so. I don't know why.
If you wish, I can share my screen from the backup.
I think it's fine, uncle. I'll just do once more. If there's an issue, then we'll do that. As
Okay.
such, it should not be. I'll not. I think I made a mistake of maximizing it. I'll not do that.
Okay.
I'll just leave it at this. If this is fine by everyone, I'll continue.
Yeah, this
Okay.
fine.
Yeah. So basically, as you saw, right, in the previous slide, so normally when you see the tooth, this is how it is.
Yeah.
This is how the tooth is. So this is within the jaw and it will maintain the shape of the tooth. But if you do not have the teeth, right, you can see this becomes very thin, the ridge. The height and the depth of the bone reduces. And also your face, the like if you see my face here, the teeth gives a little bit of support. So the lips are supported by your teeth, right? So that gives the fullness of the face. But if you do not have your teeth, what happens is the gums and the bone recedes, and you have a decrease in your the jaw dimension. It's known as vertical dimension, and that way you'll have speech impairments, and also you'll have eating difficulties. The main thing being because you do not have anything for your nothing existing for your teeth to crush. So even if you get a denture, what happens is you do not. So this is the main difference between an implant and a denture. Now, in implant, what they do is they strategically select areas in the jaw, and in this they put a implant within the bone that mimics the root of the tooth, right? And after they do that, they let it heal for a while, and then they build a crown over it like this. So they try to restore what is lost. So you just need few implants and the rest they just attach it. And this is how you actually do your treatment, right? So one advantage of having an implant versus your complete denture is the bone over here, right? So once you put an implant within the bone, it stimulates more bone growth. So that is one advantage over it. And if it mimics the tooth, so that way it helps in maintaining the homeostasis of the mouth. So if and if, but there are other factors that are very important for you to consider if you're first an eligible candidate for a denture versus a implant. Because implant, there are certain criteria that have to be met, so which I'll be discussing in the further slides. But this is the basic understanding. As you age, your alveolar bone goes down, especially in women, because the hormonal changes causes you to lose out much more calcium at 10 times more a fast rate than a normal man would. So the bone loss would be a lot more significant. And this causes your, if you don't have teeth, your ridge, that's why it's known as a knife edge. So this is what happens. And then if there is a lot of bone loss, you will not have enough space to even put an implant. So that's also one of the criteria they have to see. And as we see, right, because the bone loss is there, so this is your TMJ. Normally it is like this. So this is your TMJ. This is your mandible. That is your lower jaw. And it goes and attaches to your upper, the base of your, like the side of your skull here. So you have a disc that separates it both. Like this, there's a disc covering it. So with age, what happens is the friction causes this to go. And that and there is a loss of the disc. So that's why you get a lot of clicking pain here in this area, especially near your ear. And that keeps on radiating to your head, to your face. So the pain is very unbearable. So this is because your jaws, either it could be because of the clenching habit that I told previously, when you have a knife grinding habit, that could be one of the reasons, or else because of the age, the disc, the articular disc that is there between the upper and the lower surface gets eroded. So the gap here becomes very thin. So this is known as disc, the articular disc derangement. So, and also there's a displacement. So your jaw keeps on clicking, you get a clicking noise. Some people have pain here, they have tenderness here, they have a clicking noise. So every time they open or close their mouth, so there is a sort of a clicking sound that comes. So these are all the age-related changes that you can see. Mainly not only in your tooth structure, but the surrounding musculature, the bone, everything goes through a transition phase as you age. Because one for your body, as you age, there is the reduction in the number of cells that divide. You have rapidly dividing cells, then you have slow dividing cells. So the capacity of the cell to regenerate keeps on going down as you age. So that's why it's very important for us to take care of it. And if we know what are the changes that happen, right? That's the reason why I thought it'd be best to explain a bit about the changes that happen. So if you understand the changes that happen, you will be able to understand how to prevent them. And one more thing that happens is there is a decrease in the saliva that is known as xerostomia. And generally, this causes dryness in your mouth. Another very important thing that happens in elderly patients, which people actually let it go, because at least if you know that you lose a teeth, people would either get a denture or get an implant done. If you know you have a filling, people generally go get like if you have a decay in your tooth or a cavity, people generally get a filling done, or they go, if it worsens, they go for a root canal. But most of the things that people actually don't pay attention to is the mucosa. Mucosa is nothing but all of the, like you have a skin. So whatever you have outside, right, on your body, your hands, your legs, that's your external skin. And it acts as a barrier and prevents any sort of like it acts as a protective shield from the outside environment. Similarly, in your mouth, the entire, like if you can always feel, the moistness in our mouth, right? So that's because of the saliva, and it's always made sure to be moist, because if there's no moistness, your tongue, so sometimes when you sleep, right, your mouth is dry. So all of the, like you can feel the stickiness in the mouth, because the like you basically, what when you sleep, all your processes, your body functioning goes a little slow, so that way all your mouth, there's a lot of saliva build up, and there's a lot of, that's why you get foul breath in the morning. So these are normally that happen, and these changes basically are like, it's just been there for a while. But if like the main thing that people don't pay attention to is the change in the mucosa, the skin in the mouth. And that's the main area. Like most of the elderly people, right? There's another thing that is very prevalent in our country is cancer, oral cancer especially, because that is the area that has the most change, the mucosa, the oral skin, and all the whatever is there within the mouth, whatever changes happen with the age, if you don't take care of them, especially you have a bad habit, either if it could be because of smoking, or else if there's an exposure of any sort, especially radiation exposure, if too much of radiation exposure happens. So these can lead to a condition known as oral mucosal lesions. Some of them, if they are left untreated, like be it Candida albicans, or like yeast infection, or even if it is oral submucous fibrosis. So most of the elderly people, what they do is, especially we have this habit of having pan and gutka. So that causes a reduction in the elastic fibers in the mouth. So your mouth, you keep on opening and closing, right? So the capacity to open the mouth reduces. So these all lead to, these are all known as oral mucosal lesions. And if they are not treated right, they can actually develop into a cancer. So you see redness of your palate, you can see redness in the mouth, you can see a lot of inflammation. If it is a small, if it is because of trauma, you might have aphthous ulcers. It can either be ulceration, or it can just be a small bruise. But if you see any white change, or if you see any sort of a reddish lesion which is there for a long time, that is something that you all should be a little careful about, and it would be best if you all get it checked. So especially denture wearers, this is something that, so a lot of people who wear dentures, especially the upper denture, if you can see this place, so it's a plate that is against your palate. If you don't clean that area properly, what happens is it becomes extremely inflamed. So that entire area will become red. So that is something you all should be very particular on, that you all keep the oral mucosa clean. Apart from the teeth, because of the changes that happen, and there is a less amount of salivation, and there is a less amount of tissue regeneration. So that even more makes it difficult for the cell to basically multiply faster and heal. So these are basically some of the systemic changes. So they always remember that whatever happens in the body, the mouth is the first place where you can actually see the changes, right? So when you see anemia, like if you have anemia, they even check your mouth, because in the mouth, if your mouth is much more whiter in comparison to it being reddish, that is also a sign of anemia, apart from them seeing the whiteness in your eye. And also, if there's any nutrition deficiency, you get cracks in your lips, you get a lot of, like even if you have measles, mumps, all these. So the mouth acts as a mirror for any condition that you have. And also, these are just like normally, like apart from the drugs that you take, right? So they have different, those also affect, like if you have hypertension, if you have diabetes also is very associated, is highly associated with periodontitis. That's a infection of the periodontal ligament, which I will explain a bit. And also the other, as we see, we'll just read, I'll just explain a bit more about it. So normally for us to understand, so we know that, the body undergoes changes, and we also know that the mouth is a organ which actually shows the overall health of a person, and the significance of the teeth being in place, because it helps in eating, and also it helps in speech, and it also helps in giving you a sense of profile, a facial profile, and it adds to your personality. So now, normally so sugar is the most important culprit for us that causes cavities. So normally when you have sugar, that along with any bacteria. So normally you have different types of microorganism in the oral cavity that leads to a tooth decay that causes growth, like a proliferative growth. And this, with time, it will affect not only one tooth, it could affect multiple teeth because you don't keep it. See, a lot of people, we do not understand that, we see a small black dot on the tooth and we let it go, right? And you let it go with time, and that small gap will become a bigger gap, and then we still let it go. And then when it becomes very big, we either we there have been instances where I've been told that like I know also of people who have used clove within their tooth in the tooth, thinking that the clove will heal the tooth. But remember this, that the tooth, like we said, no, the tooth is actually once the enamel is lost, it cannot be regenerated. So there's no chance if you use any sort of any sort of a home remedy or use anything for it to go down. The only thing that you can do is if you have a little bit of swelling in the gums, if you use a little bit of salt water gargle, it will help in reducing the swelling to a certain extent. But any sort of home remedy would actually be more detrimental to your teeth than being an advantageous aspect. So normally when you have too much food, and if you have too much of sugary, sticky food, that attaches to the tooth, and then eventually it goes and becomes it becomes a breeding ground for microorganisms. So every day, when you sleep, you have a pellicle, a salivary pellicle, which forms a film on the teeth. If you do not clean that regularly, every day while brushing, so that's why we recommend you to brush twice a day. So if you have a tooth, so this is within the gum. So every day what happens is you have a film that keeps on accumulating on the tooth. This is a biofilm. That is anything that you eat, the saliva mixed with the food and all. And then if it keeps on attaching every day. And that's why we ask for brushing twice a day to remove this film. But if you don't remove it, what happens is it becomes plaque. It builds up and it becomes plaque. It's a little more tenacious than the biofilm. And once a plaque is formed, and if you have certain microorganisms, they keep on attaching themselves and they grow in the plaque. Eventually, that is what would lead to a decay. And that is how there's a progression of decay. And if this plaque, if you leave it for a long time, right, it hardens and it becomes calculus because the substance in the food, right, and it generally develops into a very thick layer. So this calculus is very dangerous. Why? Because if you let the calculus build up, the gum level keeps on receding after that, and it will come down here. So you will have more exposure of the root. And if it keeps on receding the gums, then you might even have the tooth also gets lost in the process. So all this takes time, but it is always good to safeguard the teeth. So cleaning them regularly twice a day and having a proper, at least brushing for 2 minutes, and also flossing. And I will explain the difference between a water flosser and a regular flossing technique. And also trying to see that you hydrate yourself because, like I said, as we age, the saliva producing capacity of the mouth decreases. So we should be, if you hydrate yourself more, or if you have gum which is sugar free or any sort of, it's basically helping you to, when you chew, it helps you to increase the saliva production. So all these are ways that you can actually help in promoting your oral mucosa to be more healthy. So like we just saw right now, around the tooth, you can see the bacteria enters the bone and it causes the infection. And that's how you can see here normally, this was the level of where the bone should be. All this is supposed to be within the jaw. So all this is supposed to be healthy, right? So if you can see all this area, this is calculus, this part here. So this is calculus here. All this around the tooth, this is the calculus. So the calculus basically deposits around the tooth and it causes the migration of your gingiva. So when it causes the migration, what happens is your gum line recedes and the bone is also lost. And if the recession happens, you have different grades. If it is grade 1, you can use with regular cleaning, like cleaning and root cleaning, you can save it. If it's grade 2 also, to a certain extent, if your body heals properly, you can do it. But if it's grade 3, generally you will have to extract the tooth. So in order to prevent all that, it would be better if you try to actually keep it clean. So this is how your gums, it is a scallop shape. Normally the gingiva, this is a scalloping that is seen. So when you lose the normal scallop, it will become a horizontal line. And eventually the gums and the bone keeps on decreasing. So that is not a good sign. And also some people who have diabetes, it is much faster. So, and also if you have any sort of an hormonal imbalance, those also can, to a certain extent, make the process faster, but it is not like it cannot be prevented, because all these basically are just like safeguarding your teeth. You can just regularly get a tooth cleaning done. That's what I was trying to say, right? Two procedures that are very important in a dental clinic. One would be your tooth cleaning, getting your teeth cleaned by a dentist that is professionally clean. So that would help in removing all this around the teeth. So once you remove all the plaque and the calculus, you will not have any place for all this will be removed. So it will allow for the gums to reattach. So when you do a professional cleaning, what happens is all this will get removed. All this will get removed. All the infection and the bacteria and all the calculus and the debris is removed. Then it allows for the normal gums to come up and attach to the area. So this helps in cleaning, actually helps in your maintaining your gums, and it is, and also the bone health, because if you do not know what is happening within the bone, because all you see is the teeth, and a lot of people they do not when you have like black deposits on your teeth, when you have yellow deposits on your teeth, people just let it go. But if you let it be for a while, and they think it is normal. So there was this one patient who came to the clinic and he had a thick band of calculus around his teeth, and literally the tooth was attached to the bone by the calculus. And he refused to get it clean, because, and also we also didn't bother cleaning it, because if you touch that, the tooth will come out. And the teeth are actually held in place to the other teeth because of the calculus band. It was like a collar around the tooth. So if you don't clean the teeth regularly, what happens is the gum and the bone will recede. And that is not a good thing. So yeah, these are like how you can see the infection. Some people have redness in the, it starts off like this, where it is inflamed and reddish. Then eventually it keeps on progressing. Can you see the bone loss here? So this is all the bone loss that you can see. Normally the level of bone should be here. So the bone loss is almost till here. So if the bone loss also happens on this side, eventually the tooth will fall off. So these are things that people should be very careful, because losing a teeth, once you lose a teeth, you cannot replace it. And also, if you lose the bone, it gets difficult for you to put an implant. So keeping that area clean would be, so this is all calculus that you can see. These are all thick bands. Like these are all, and all this white, which can be removed from the teeth a bit, that is the plaque. And once it becomes harder, that is the calculus. So another thing that a lot of people don't want to acknowledge is malodor, oral malodor, that is halitosis. So a lot of people aren't aware, actually most of the people aren't aware that their breath could be bad, because they are so used to talking, and because you don't smell it that much, right? So a lot of people are not aware that there is a thing called as bad breath, and also it could be that we have bad breath, like you yourself have bad breath. So the most common reason would be because you don't maintain your oral hygiene. Because obviously, if you don't have a bath for 2-3 days, you smell. Same thing, if you don't brush 2-3 days, your mouth will also smell. And also, especially denture wearers, they do not clean they do not clean the denture properly. They just assume that that you just have the denture, you just put it in you have a glass of water, or you have a box in which there's water, you keep the denture in it, and everything is fine. But actually, there's a process to it, that there are denture tablets that you keep it in the water, and it actually helps. Or else some denture powders are also there, cleaning powders, that you are given in order for you to clean the dentures. Or else, even when you're brushing, you can just use your toothbrush and your toothpaste and clean the undersurface. It's not the surface that is seen outside that's important, but the part of the surface that it actually goes and touches your mouth. That is more important to be cleaned. So these are things that you have to be, especially denture wearers, should be a little mindful of. And like I said, so as you age, xerostomia, that is the decrease in salivation, is very common. So that is something that you need to hydrate, and you need to regularly go get dental checkup once in 6 months. And you should also see that if you have any sort of a gingival, or your gum, or your gums are fine. Because normally, if your gums are not fine, or there is some issue. Role of calcium. Okay, can I?
We can take up the questions after you finish.
Okay,
They'll keep coming. Don't bother about that. We'll pick them up.
Now I was thinking if I have some questions in the thing, because I just happened to see it just came up.
Okay.
Fine. I'll continue. Is it? I hope my voice is clear so far. Is it? Yeah.
Yes. You're clear. Yeah.
Okay. So one thing, I think this is a very easy trick that most, even I do actually, that I use gum. So that you get these sugar-free lozenges and gums, right? So when you chew, right, once your appetite goes low, if you're feeling hungry, it just helps in suppressing your appetite for that small instance. And also apart from that, you like it also helps in increasing the saliva in your mouth. So these are small tricks that helps, to keep your mouth moist. So you're just stimulating your muscles to create more saliva. So that is something, if you'll carry, like sugar-free gum with you all. So whenever you feel, you can chew a bit, so that will help it activating your muscles. So that also can be a nice aid for you, for anybody who's elderly, to actually use. And also what we eat. So a lot of people as we age also, our diet also changes. Like we prefer simpler food with less spice, and with less colorants, and also which are less starchy. And this change actually is good for your teeth as well, apart from your overall health. But if you have a lot of sugars, especially like when you're young or old, because the milk teeth also gets affected faster, as well as you get old, it'll actually cause much more complications. So being mindful of what you eat, having more of fibrous food, having more of simpler food rather than refined food, these things can actually help in the long run. Because if you have more of sugary and starchy things, it can actually cause more bacteria to grow, and also it can get attached, especially in the crevices between your teeth. It can actually get lodged over there, and it can actually putrefy, and it can also be a breeding ground for microorganisms. And cleaning your teeth twice a day is very important. A lot of people think once a day is enough, and sometimes even I also do once a day, but it would be ideal to do it twice. Because when you eat and then after, when you have your last meal and then after a few hours you sleep and you don't clean, what happens is you still have that debris or the remnants of whatever food is there in your mouth, and that is there till the next day. So at least after eating, if you'll make it a habit to rinse and brushing twice a day, that would actually be good. It will be a good habit to inculcate. So oral candidiasis is also like so it's thrush. It's also known as oral thrush. This actually affects a lot of elderly population, much more than younger population, because it is also caused because of the systemic changes that happen. That's why your defense capacity and also your because of all the other changes we saw in terms of the salivary the decrease in the saliva production and also the cleansing capacity of the oral mouth, you can have a chance of having candidiasis. So that is something that you all should be a little mindful of, and this needs to be addressed if anybody has like even a little bit of like rather than it's spreading for a long time, detecting it at an early date would be a little better, and then it just the treatment is not that difficult either. So the dryness of the mouth is another thing. So that normally you have taste buds on your tongue. So the sense of perception of taste is basically because of your tongue, nothing else, because you have taste buds. You can feel the warmth in your mouth. You can feel the coldness in your mouth. You can feel things in your mouth. But the taste, the salt, the sour, the sweet, and also the spice and the bitter is all because of different locations on your tongue have specific taste buds. So these actually cause you to have like the perception of your taste is basically purely by your tongue. And because of the lack of the saliva, if you notice your mouth is always moist, especially your tongue also, it gets moist. And when you speak a lot or when you chew a lot, the amount of saliva produced also is more because you're keeping your mouth active. But if you have dryness in your mouth or you feel the dryness on your tongue, the capacity to speak and also you have a slurred speech and you also have a little bit of difficulty. And you cannot, even the taste also gets altered. So this is also another thing that happens as you age, that the taste perception also changes. So this is something that like I said, like if the dryness of the mouth is a lot, then you need to go to dentist and they will give you a treatment for the same. But if it is a less amount of dryness, having water at regular intervals and also chewing gum that will stimulate your mouth to create more saliva would be a good alternative. So these are like, this is the denture that you can see. So sometimes so denture, what happens is like sometimes on the inner surface of the denture here, while wearing, what happens is if there is a bump or if there is a sort of an extra plastic acrylic area, it'll keep on impinging on the gum and it'll cause redness. And also, if you don't clean, you might have denture stomatitis. That is the inflammation of the oral cavity that we saw. That is because we don't clean the denture, the undersurface of the denture properly. And also, if the denture is not like if you don't wear the denture regularly, you could have a loss of the bone, and the denture might also not fit properly. Or if the denture is too tight, it is better to let the dentist know at that particular moment, because it will actually cause a loss of the bone much more because it is causing trauma to your existing bone. So these are something you all should be very careful about, because denture and implants are very tricky, because you need to, it's not like once you put it in your mouth, if you don't take care of them, it's done. You need to properly take care of them much more than what your teeth are. So diabetes, especially people who have diabetes, getting any dental treatment is much more trickier because it is a very like a tooth infection of the gums is a very common what do you say? It's one of the common complication of diabetes. And what if you don't like because of the uncontrolled, especially if you have uncontrolled diabetes, the loss of teeth is much more, and the loss of the gums is much more, and it causes the tooth, especially the periodontal ligament and the gums, to recede. This, like what we saw previously, normally you can have calculus which causes the recession, but in diabetes, what happens is because of your body, the systemic effect, there is a natural loss of bone and there's a natural loss of the attachment. So this also causes the teeth to move and shake. And if you don't take care of it at an early stage, you can lose your teeth as well. And if you actually maintain your the diabetes level, like your sugar levels properly, it can have a good effect on your gums. So it will actually benefit your gums also if you have diabetes. So spittle. So normally some people have a habit of spitting when they speak, right? So this could be because of a numerous reason. One is because of the denture fit. Like I said, if you regularly wear dentures, if you don't wear them as they are asked to be worn, and if you don't maintain them, or else if the fit of the denture as such is not proper, what happens, it causes a little bit of space. You'll have that hissing sound. Some people have that, some people have a little bit of gap between their teeth, so through that they can actually a little bit of saliva can come out. And also if it is not fitting on the bone, the denture can shift a bit, and that also could cause a little bit of saliva accumulation. And also, if you take certain medication, that also causes more of saliva. And that also can, any excess saliva build up in your mouth, you end up spitting it. And in case of anybody having any sort of neuromotor dysfunction, where your muscles of your mouth, especially your, the orbicularis oris and your masseter and your buccinator. So these muscles basically they surround your mouth and the cheek. So if they are not properly in tone, so you'll see drooping of the lip, and you'll also see a little bit of the tonicity of the muscle. If it is lesser, you can see saliva pooling and spilling from the corners of your mouth. So these are all if you have some sort of a neuro muscular issue. And the normal remedy would be is either adjusting a denture, and like I said, like drinking the same thing. If you have like to maintain the tonicity, we generally ask people to have a salivary stimulant, so that will help in the chewing action, will help in toning the muscles around the mouth, and getting a periodic review by a dentist. And if you have any underlying condition, it could be like you can associate a certain type of neuromuscular disorder because of the symptoms that are presented, and or else if you have some sort of a systemic condition, that could also lead to it. So maybe if speaking to the doctor as well as your dentist could help in a way to figure out a solution for the cause. So dentures are, you have three types of dentures. You have a removable, you have a fixed, and you have a complete denture. Now, so now you have a tooth like this, you have a gap, and you have a tooth like this. So there are two ways that you can fill this, and then you don't have anything. So if you grind this tooth, and then you put a cap over this tooth, you make a tooth here replacement and you put another tooth here. This is known as the fixed partial denture. Okay, because it's permanently cemented on the adjacent teeth, which have roots. Now, if in the same place, I just put a, a tooth like this. It's just and it has a denture flange here and it has another denture part on the other side. So this I can remove it at night and then wear it again in the morning. So this is another thing. This is a removable partial denture. Now, if you have to do for the entire upper and lower, that is a complete denture, where it replaces all of your teeth. So genuinely, nowadays people don't prefer complete denture because it is a hassle to remove it every night, put it every night, maintaining it, cleaning it, getting it changed once in 3 to 5 years because the bone level keeps on changing. So now people prefer implants where they put a screw within the bone, then it has an abutment on it, and around this you have a tooth. So that the surrounding teeth are not affected. This is the most straightforward and easiest procedure without causing any damage to the pre-existing structure and also replacing the structures which are lost. So that is one thing. But the main things so this is the main difference between the 3 types of denture that I showed and also the implants. Now, the main problem with the implants is people think that once you put the implant, it is fine. You don't have to take care of that. But that doesn't work. You have to keep on regularly going to your dentist. And if you are capable enough of cleaning that area, if you are if you have the most important thing that they see is the bone density. If your bone density is good enough, you can go ahead for an implant. And also, you should take proper care because especially if you have any underlying condition, you need to see that the care that you do for taking care of the implant is good. Because normally when you put an implant in the bone, the surrounding bone should attach to it. So this is known as osseointegration. So the amount of osseointegration that happens, the better the osseointegration, the better the longevity of the implant. And the poorer the implant osseointegration, there is a chance that the implant can also fail and you can lose the implant. So this is very important. Like, within the bone, the implant gets integrated to it. So for that to happen, it needs to heal over a period of 6 to 8 months after the implant. So in this time period, utmost care should be done. It's not like once you put the implant and then you're done with it. After that, and during this process, you should regularly go like once in 2 months and get it checked, or once in 3 months and get it checked. Because if there is any redness around it, if there's any loss of the gum level, all these are like warning signs of the implant failing. So you should be very careful, especially immediately after the implant and the first 2-3 months after placing the implant. So this, like I just gave the explanation, they are surgically placed and they fuse with the jawbone. Whereas the partial, if it is replacing few number of teeth, it's a removable partial denture. If it is the entire arch, that is a complete denture. So implants is a very good option because it is the minimal amount of the remaining tooth structure that is there, you're not damaging it. So what is oral care? How do you think oral care is essential? At any age, oral care is very important. And why flossing is something that, I don't think Indians are taught about flossing much. It is a very foreign concept that, a lot of people have slowly started inculcating in them. But normally we just know the traditional brushing, where you just take either a medium or a soft brush. And then in that, what you do is you take a pea-sized amount of toothpaste and you brush in circular motions. And the circular motion is very important because you clean from the gum level to the tooth, and you're trying to stimulate the gingiva also to cleanse, to act like a self-cleansing area. And if while using a floss, it is important that you use your arm's length from here to here, your and like a little bit like whatever length is comfortable, but then you wind it up and then you have it closed as much as possible. You just get it into your between your teeth, and then you kind of try not to. One thing that a lot of people make a mistake is, especially when you use these kind of interdental aids, is that you go very close to the gum level. So if you push it too much, what happens is you're doing more damage than more cleaning it. So you should try to do that. You slowly ease your way into it. Just try to like go back and forth, and then go in between, and then clean that area. And whatever part of the floss that you use, you should not try to use that same area. Use another area of the floss, because it's either waxed or it has some sort of a coating which helps in cleansing that area. So that is one thing you should keep in mind. And second thing is, people who use toothpicks, and worse, some people who use safety pins. That is not something that I think is, unless and until, like, especially after we eat, we try to like pick, and then, or else worse, we put it like into our gums. That is not something that is ideal. So if something is stuck, gently try to get it off. And if it is close to coming out, just rinse your mouth. So whatever that residue is there, right, the flushing action of the water helps in dislodging the food, rather than trying to, keep on continuously pick on that tooth substance. See whether even, using water to remove that also helps. So so gently after you use the floss, gently like going in between the teeth and going back and forth, and then slowly doing, like, you can either start right side and then go to the left side, or you can do the upper and then go to the lower, whichever works for you. But see that, you try to get all the areas of the tooth. But if flossing is very difficult, there's another thing known as water flosser, which works similar to it. So there are certain points that you have. So each water flosser is a little different, but the make is almost similar. You have the low pulsing setting, and then you have the moderate, and then you have the high, and then you have burst. So whenever you like how this lady she is actually angulating her head to a particular side. So why you do that is so that you help the water to fall into the sink. Always remember never to switch on the flosser, because it has high speed. It could actually injure you. So it would always be better that you get close to the sink. And once you get close to the sink, then you tilt your head. And then after you put the probe within your mouth, then after that you start it. And start from the lowest setting and then build it up. And then same thing, you can go from either the left to the right, or you can do the upper and then you can do the lower. But always remember that always switch on the flosser once it is inside, the tip is inside your mouth. So a lot of people have benefited a lot with water flossing, because it's already a designed thing where you already have the pressure and the optimum pressure to clean the areas. Second, it also stimulates the gums, so that cleansing action of the gums also is also happening in this situation. And apart from that, it also helps in the health of the gums, because with the technique, the traditional flossing, what happens is when you try to pry the floss, if you don't do it properly, you can actually push the debris into the gingiva. But whereas in water flossing, it just is a burst of water. The only thing you should remember is that the nozzle, head of the nozzle, should be parallel to the teeth. So it should be perpendicular to teeth and parallel, put at a level which is parallel to your occlusion. So this was a small, like, I just wanted to like briefly speak about one thing, which is a little like, as we said, as we have the changes seen in the elderly, oral cancer is something that is a topic that not many people speak about, because what happens is as you age, that people generally just see, like, they see like teeth being replaced, or else either implants or getting a denture done or getting your teeth clean, but people don't actually give importance to deaths happening because of oral cancer. And in India, we have quite a prevalent number of deaths because of oral cancer. And generally, this is seen mostly in the rural areas, because we have a lot of tobacco consumption, and it's not smoking tobacco, it's smokeless tobacco. So normally people, they chew pan, they chew gutka, they chew kaini, and they just leave it in their mouth. So you can see like a thick band of like the orangish and pink, reddish residue on their teeth. So that also can be a source of the changes that happen in the mucosa, and that eventually can also lead to cancer. So in males, this is the statistics that I'm showing you. In men, the lip and oral cavity cancer is quite significant, and it is much more than women because of the tobacco habit. And it is actually it accounts for 47.2%. It's more than it's close to the lung cancer. So this was just the brief talk on like what are the changes that you see in the oral mucosa, and what are the things that you can, like the aids that you can use, and also the treatment aspects that you can consider. And why is it that, like this is a lot of people, like, in India, like I said, not many people, especially elderly people, give importance to oral care. And generally they do for other parts, but not for their oral cavity. This is mainly because it is known that certain treatments are expensive. Dental treatments are expensive. And second, you have, it's either the social conditioning, or else because of your health reasons, or because of any underlying conditions, you choose not to get it done. And also, like I said, the oral issues mainly being that the salivation reduces. There is a lot of changes in the mucosa. There's a lot of changes in your salivary glands, and also the bone density changes. So it's a very complex situation, especially for a geriatric patient. So the main active barriers being mainly on the patient, where there is a lot of people are scared of dental care. And a lot of people are mainly worried about the cost. And also in some areas, the accessibility, especially like I said, geriatric specialization for geriatric dentistry is not there, and it's not been taught in the curriculum. It's just general dentistry that has just been practiced. And the main passive barrier is because there's still a lot of stigma for getting dental treatment done, and also people don't see the value of it. Apart from the stigma, a lot of people don't even want to acknowledge that, okay, yes, I have a dental issue. They're still like, it's fine till it gets really bad. People generally don't prefer going to a dentist. So unfortunately, there are no there's no provisions, because dental treatments are expensive. Why? Because it is an inert material that you're putting in your body, and the material that you put in your body should last you for years to come, right? And it is for you to have a biocompatible material. The research that goes into it, and also the production that goes into it, causes the cost of it to increase significantly. So that is why dental treatments are expensive, and also the setup for the dental, be it the armamentarium and the chair, and also the personnel needed, it is a little bit of a expensive setup. So all this adds on to the treatment. So a lot of people fear going to the dentist for the cost more than the functionality. So they think it's okay, I rather let it be for now, and once it gets bad, then I'll go see the dentist. But that is not something that you should do, because if you do a filling for like 2,000, 3,000 or 4,000, it's much better than getting an RCT done and getting a crown. Because if you do an RCT, the tooth is anyway compromised. And if you don't do a crown over it, the treatment is of no use because the tooth can crack any second. So always after getting a root canal treatment, it is mandatory that you get a cap. And that cap also, it is almost 6-7 times more than getting a filling done. And depending on the material of the cap you do, it gets even more expensive. So this is a suggestion that a lot of people have given, where we also believe that apart from normally there should be more campaigns where we should actually teach people about the benefits of having proper oral care, and also encourage flossing and cleansing habits. And also, if there are initiatives taken by the government for having public health campaigns, or having mobile technology and teledentistry, and also having different changes, they can have programs where they can have basic treatment provided, and make it more accessible, it would be a little easier. So this is one treatment consideration that was adopted in the West, where basically this is the treatment that they consider, how they approach whenever there's an elderly patient, how do you approach the condition? You see their oral factors. If there's an underlying systemic factors, then you see whether how the the well-being of the elderly patient is, and then you take the based on how reactive the patient is, based on that you give the treatment. So these are just I'm not going to spend much time on this. Basically the whole, it's not just the individual that needs to know, it's also the curriculum base, because whatever we are taught in dental schools, it is not enough to treat an elderly patient. And apart from that, there should be much more sensitization in the media, where they should actually make much more beneficial talks, and much more accessible talks, where you will get to know more on how you can take care of your oral cavity. And main thing is, if there is a proper, I did a lot of research where I try to figure out if there are any proper there are proper, for the elderly, only few treatments are covered, but other, most of the dental treatments which come under cosmetics are not covered by your proper under any insurance, because these are all aesthetically done, and even if some are covered, they are very basic ones. So with an advent of dental technology, you have these two things, especially teledentistry. You have mobile van, dental vans, where you can actually provide treatment to most of us are fortunate enough that we have access to dental care, and we can actually discuss all of this via Zoom. But everyone isn't that fortunate. I don't think most of the elderly people can actually make the effort to go and see, or at least ask about what can I do for my oral health, because one, there is a lack of awareness on it, and secondly, I think they would not they would go, but they will not they'll not understand the options that have been present in front of them. So I think having teledentistry, where you have at least the basic procedures that are there for the elderly, especially if that is accessible, I think they will at least enjoy, having their teeth for a few more years, and at least enjoy, eating, speaking, and all of that. So these are just I just looked up, like I said, I looked up certain this thing, and these are a lot of things are there that we can do, but understanding we have support, we have proper laws in place which can actually help, and we have a senior health program which also gives a little care for the dental patients, especially when they are elderly. That would be a little more beneficial. But I feel even having awareness camps and having maybe on a larger scale would benefit. So these are certain, like, fluoride treatment is something that you all can actually do, because fluoride prevents dental caries. Having fluoridated toothpaste could benefit to a certain extent. And mouthwash, using mouthwash could also, after brushing especially, can prevent, it's an anti-tartar and anti-plaque forming agent. So it will prevent the forming of these, from forming of tartar and plaque, and that will prevent the buildup of calculus. So it all promotes the gingival health. And there are certain salivary stimulants, like I said. And yeah, as we age, we all know that, you have depletion of calcium. So supplements on that was also essential. So I will end my talk here. And if there's anything that I've missed out, or if I've like rushed forward with, I'll be more than happy to speak about it again.
Thank you, Aishwarya. Would you like to unshare your screen?
Yeah,
There are
I'll
questions.
I'll do that. Thank you.
Yep.
Okay.
I don't think
So,
we have ever spent an hour learning so much about our teeth. We take them for granted. So let's take up some questions, maybe the simpler ones first. Like you were reading, what is the role of calcium? And
so calcium.
the big question is, why is the wisdom tooth called the wisdom tooth? Does it really give you additional
So
wisdom, and
no,
should you
no,
retain it or remove it?
no, that's a misnomer. It's nothing like that. So normally you have your first molar. So you have your milk teeth that erupts in when you're 6 months old, and it is there till you're 6 years old. So you start having your permanent teeth at the 6 years of age. That is known as the 6-year molar. Then you have another one at 12 years, and then you have the third molar that comes out at 18 or 21. So they assume you should be wise by then. So that's why the
Okay.
name wisdom. And retaining it does not make, actually, I think everybody is aware of appendix, right? It's a vestigial organ. So in the older races, appendix was there, and even the pituitary, the pineal gland. So as like even we had hair on our body. So all of that, as we evolved as a race, it's not there in us. So the future studies say that, we could not have third molars in the future. That's why they get impacted, and some people don't even have the third molars. So that's like, because the functionality of it is not needed. Because when we were more of the Homo sapiens and the Homo erectus era, we used to have much more sharper canines, because we had more of meat eating, and we were more in the hunter-gatherer phase. But now we have more of processed food. So it has nothing to do with wisdom. It's just a normal physiology that is there. So hopefully in the future races, that's why Chinese have smaller mouths, because they eat, and African races are supposed to be the primitive race, and that's why they have very strong mandibles and they have bigger teeth. So that is just a process of evolution.
Okay.
And yeah.
One related question: do dental problems, do they lead to heart problems?
So yes, so if you have, there's a thing known as subacute bacterial endocarditis. So if you, especially Staphylococcus aureus, it's an organism. If you have any prosthetic valve, or you have any sort of it does not cause, but if you have any prosthetic valve, or you have some treatment done in your for your heart, so there because of the especially if you have more of propensity of your it depends on the person again. Some people might not, but there are higher chances of you to get subacute bacterial endocarditis because of the if you don't maintain your oral hygiene properly again. So the bacteria leaches from your mouth and it can affect. But if
Okay.
you maintain it, is fine. But you should get yourself checked regularly, and before doing any dental treatment. Normally, when they say you do a dental treatment, if you have an underlying heart condition, they give you antibiotics for prophylactic antibiotic coverage. Then only you should do. So that is something you should keep in mind.
This is about the traditional method of cleaning teeth. Our ancestors, even our grandparents, and whom we have seen, brushing teeth twice in a day was not a common practice. And also they used to use
The
neem branches, right? But what they used to do, it's considered impolite now, is after every meal, they would really gargle well with
That's a
water.
good thing. Actually, this was a talk when I was in AV Shetty. Actually, a professor of mine told me this, that, there are a lot of things that we used to in the past that, right now we don't do. He's like, if you can't do it, you cannot spit somewhere. After you finish your meal, just have a mouthful of water. Just rinse it. He's like, take it in. Anyway, it's your food. What you just ate. Why are you so conscious about it? So I do that. I still practice that.
So is it also a good habit for dental oral hygiene to drink water after taking food every time, after every meal? Not just for gargling, but also, does that also wash down, is a question which was posted.
So it depends. I think I do it. So there's no science behind it. It's just that I feel so because normally, especially when you have sticky, we have a lot of starchy food that we eat, right? And they definitely, and when you eat immediately, that is when the tooth is not that adherent to the tooth. The food is not that adherent to the tooth. But if it is left for a long time, and especially within the first 60 minutes of eating, that's when the the glucose or the bacteria in the mouth, that is when it's more active, the first 60 minutes after you ingest. So immediately, the sooner you clean, the better.
Okay. You did speak about radiation and its effects, consequences. Now, um, does blood circulation deteriorate post radiation, and how
Does.
does one promote angiogenesis?
So, Uncle, actually, when normally any radiation, especially when you do cancer chemotherapy, or whether even if it's a small, like you have like radiographs or anything that you're doing for a longer time, what happens is your cells get affected. So each cell type is different. Like xerostomia, that is the dryness of your mouth. One of the factors is exposure to prolonged radiation. So that's why, the angiogenesis part. So the blood cells, RBCs, they regenerate once in 120 days. But as you get older, right, the dividing capacity, like I said, it goes lesser. In some areas, if and if it can get regenerated, most of the time it does, but sometimes it does not. So there is, like, understand, you speak to a doctor. See, it also depends on the underlying systemic condition, uncle. Some cases, right, you do not know. If it is a normal person, some person can be 35 and have an underlying systemic condition which could impair it, but somebody who's 70 who's fit can heal faster, and the regeneration capacity would be much more better than somebody who's younger. It all depends on like certain conditions, be it especially hypertension and diabetes. A lot of people don't realize how diabetes is a sort of a silent killer. So that is something that by speaking about it or talking about even the slightest thing, it's just a normal checkup and a normal awareness that could make a difference.
How often do you recommend senior citizens to go for a dental review or a
Once in 6 months, once in 6 months
once
for
in six?
anyone. And depending on the condition more, especially if you have implants, once in 3 months. Because see, implants, people don't realize when you put an implant, that's not the problem. The problem starts when, when after it is in your mouth, post-op care is much, much, much essential. Because you just see the cap that is there outside, but you don't see
Outside.
how it is in the bone. And the area between the tooth and the gum, it will keep on, especially if they leave a little bit of space, because if you keep it too tight, that can also cause trauma. So they do it in such a way that it's self-cleansing. But if you don't take care of that, you are actually worsening that.
Okay.
So you need to get it checked at least once in 3 months. And yeah, and
Two questions. One is, you spoke about Krishnamurti garu ఒక్క నిమిషం ఉంటారా? Yeah. You spoke about flossing and also
yes,
the water flosses, but you also have this interdental brushes, which have a
yes,
micro brush at the tip.
yeah.
That is the first part. Are they also good, or
So, uncle, everything depends on the technique. A lot of people see aids are good, but the technique, like I said, people toothpick, people actually push it up there, so that also causes. And this interdental, see, flossing is much better, because the reason why I prefer flossing over an interdental is because you know how much pressure to put.
Yeah.
Whereas in this case, it is a plastic handle that is there and the brush. So you keep on poking it or you keep on, unless and until you, if and if it's also a good aid, but knowing how to use it, how much pressure to use it, how rightly to use it is also a factor. You can carry them. The only, when you are traveling, when you not want to, especially when you can carry it in your purse or in your bag or, in your wallet, if you really feel you need to do it. But if not, a floss is good enough.
Okay. The second part of the question was the material for the crown or the cap. Now, is it better to use zirconium over the regular? Nowadays, I think there is a lot of new materials also
Yes,
have come in, right?
zirconia. Yes, uncle. Zirconia, they are different grades. So you get a card with the zirconia crown that you get. So initially, you used to have a steel crown, stainless steel crown that was there, and that was an inert material that would not affect the tooth. There are a lot of people who still have them, and actually, that is one of the more tried and tested material that is there. And then you have cement you have ceramic fused with metal. The inner surface is metal and the outer surface is ceramic. So, but problem with that is when you bite into it, no, there's a chipping off of the ceramic on top, and you can see the metal underneath. So, if you are, and also the crack can propagate, right? So, it's aesthetically that also, if it is cemented well, it is fine. But the most aesthetic and the most durable and the best material available right now is zirconia, and you have different grades of it. And that's why they give you, whenever you get a crown done, they give you a card with a warranty, like 5-year warranty, 10-year warranty, 15-year warranty, lifetime warranty. So that is just the grade, the lab technician giving you the best, the type of zirconia depending on the area.
Do you also recommend like once in 6 months a visit to the dentist?
Yes.
That whole X-ray, OPG. I don't know the
OPG
words.
is not, no, OPG is not required, uncle, but cleaning, yes, because see, a lot of us, especially, I think we do not, like, we cannot, as much as we can clean, no, in between teeth, like now I have braces, I can feel, a little bit of calculus build up for myself in the inner surface of my teeth, because I cannot, as you age, also the dexterity is not that much, and also certain parts of your teeth you cannot cleanse properly. So getting it professionally cleaned with a scaler, and then it also helps in the reattachment of the gingiva. So it will help actually stimulate the gingiva to get more stronger.
Okay. You spoke about the mouthwashes.
Yes.
Now there are two aspects that have come up in the questions. I'll let me tell you both of them, then you can answer them together. One is, these mouthwashes are concentrated, whether you should dilute them by mixing water, and do you use it before or after food? That is one part. The second part, which Dr. Arora has put in, is interesting. Let me bring that up. He has said that patients with COPD, bronchial asthma, and emphysema
Emphysema,
need to use bronchodilators with steroid and antinomycosis.
actinomycosis.
And proper use of proper mouthwash with salt plus turmeric is a must with massage of gums. He says that is a better option because some of these mouthwashes can be harmful. What are your views on this?
So salt and turmeric as this thing, as a massage of your gums. I see curcumin is an active compound that is there in turmeric, and they've done a lot of research on it, and it has a lot of good research on it. But that is a preventive measure. Most of these therapies and the homemade remedies that we have, right, and whatever has been passed down to tradition, they are just preventive. But the dosage, it takes time for the action to be seen. If you want immediate results to be seen, normally you use you take the allopathic way, where you use medicine and you use you use antibiotics, and then you take painkillers, because they act much faster. They go into your bloodstream much faster, and the action is much better. For maintaining, yes, you can use those, but generally, turmeric and salt. So salt has this thing where it will reduce inflammation. So when you have swelling of your gums, if you have salt water, it basically helps in removing it. So that helps in using a sort of a cleansing method. But as a salt and turmeric is not something that I would advise. And for candida, I just spoke about candidiasis, right? So it's a fungal infection. So that is very difficult. It's actually when you're immunocompromised, when your immunity is lesser, antifungal infections are much more common. So that also, I think, taking when you have a fungal infection, taking antifungal medication is the best way for it. Using all other simple methods like this would not be that beneficial in my eyes. And bronchodilators and inhalers that you use, right? So actinomonomycosis, the type of it's known as Ray fungus. It's a bacterium that grows. And this also, all these are like, yes, they will happen, but it's a very rare, like, they can happen, but these will happen when you are not careful. It's not like, you'll get them very often, like how even in a heart patient, when, you can get endocarditis. That is only if you don't take proper precautions and you aren't very careful with how, you go, once you do the checkup. So whenever you have an issue, you go get a checkup done. Then after that, based on the underlying systemic condition, so all these things are known as systemic conditions, where you can have, asthma, you can have you can have emphysema, or you can have a prosthetic heart valve. So these are something that you have to mention to the dentist before getting the treatment, right? So when you're doing the treatment, that time only the doctor will put you on a preventive antibiotic coverage or an antibacterial coverage. So all of this is prevented. So the infection of candida is not there. The infection of antimycosis is not there. So these will happen, but you can prevent them also. And doing the turmeric and salt is just like a more of a supportive treatment.
Here's a very interesting one. I'm sure everybody will find this interesting. How to regenerate teeth. I mean, you said that it's a lifelong thing. And, Dr. Arora was, he says he was involved in a research 20 years ago where they were able to get the snake and alligator's enzymes liberated from DNA, RNA axis, which stimulate the regeneration of tooth. Any thoughts on this, or it's you're probably not?
So actually, so a lot of people, so you have stem cells. So you have dental pulp cells also. There's been a little bit of research where they see once tooth is lost, is lost. So I also have like 2-3 implants. I had an accident and I have a crown. So it is hard to get teeth back. And some people, what they do is they take your pre-existing molar. So they grind it. They grind a part of the, they make sort of a paste or a callus that can be put into the gums for the bone to grow. And also some people try to reimplant tooth. So nothing has worked. The only thing that you can do right now is the dental implant. But yeah, research is definitely there. Nothing that has come that significant for us to actually grow a full grown tooth. But hopefully we'll get there. So they have these printing. So I was told that they're even trying to do organ printing. So this is another thing where they're trying to actually replicate a whole organ. So these are something. So hopefully in the future we can get that.
3D printing of human organs.
Human organs.
Would you like to answer that question about diluting or not diluting the mouthwash?
So when so certain mouthwashes have a cap on top, right? When you press them, there's a amount that gets filled. Or you have the top lid, you take the amount in it and you can put it and use it. It is okay if you want to use it as such, but sometimes especially if you have a lot of Clohex mouthwash, that they use as dilution. Listerine also you can use as is, but you can use 1:1 dilution. More than that, it will not be effective. So so it is always good. So mostly people, what they do is they brush and then they just rinse and they spit it out. But you should brush for minimum 2 minutes and you should use a circular motion. That way you're stimulating your gums. And after you brush, you can give like a little bit of a gap and then use mouthwash and keep it in your mouth for 30 seconds at least. And, flushing, use that very strong, flushing action. One, so it activates your muscles. So it'll help in the tonicity. Second thing, and it'll also help in your saliva secretion also. And third thing, it helps in removing whatever little debris is there, no, which the brushing could not take out. And after you do this thing, after you use a mouthwash, it is best to so they have some active ingredients in them, be it chlorhexidine or some anti-plaque or anti-tartar agent. So immediately after you use a mouthwash, it would be best not to eat immediately for like at least 10 to 15 minutes and then eat, so that the effect is much more longer.
We're done with the questions on the chat. Dr. Krishnamurthy garu, would you like to ask your question? You unmute yourself, and he's a very senior radiologist, an old friend of mine. He was a chief radiologist at RTC Hospital.
I worked in RTC up to 2003. Then I worked as a radiologist, especially conventional, till 2020 at Vijaya, main Vijaya. I turned 79. I never used any mouthwash or anything. One thing I wanted to ask: is it every month we get grocery? Should we add one new brush every time?
Not necessarily. 1 to 2 months is fine, sir.
Okay. And another thing, we are very ruthless to the children by forbidding them eating the chocolate. Is it really sustainable admonishment?
Sir, actually, it's not the
because
chocolate.
I am fond of chocolate till today. I eat chocolate immediately. I rinse them out. That's all.
Sir,
Of course, I have 3 teeth were fallen with naturally, but I have, thank God, I have a strong teeth. I never this thing. I only think in the night and in the morning I just brush. That's it.
Sir, eating chocolate is not the issue as much as maintaining it, because see, a lot of people, what they do is, it's a sugary substance. So it has sucrose in it. So sucrose causes growth of bacteria. So that causes cavity formation. So normally for some kids, what they do, especially a pediatric dentist, would say eat once a day in a week. You can eat how much you want. The rest of the time, don't eat. So that is there. But even if you eat sugar, it is better not to eat it before night, before sleeping, or else, like after eating, cleaning it, because like I said, after you eat something which is sticky, or, which is starchy, or which has a lot of karyogenic food. So that the spike, the pH of the pH level of the mouth changes, and that causes more of bacterial aggregation around the tooth, and that leads over time, that leads to cavity formation.
Only thing is we should insist that our children rinse properly. That's all. I think
rinse, yes. That's what I was just telling.
That minimum precaution is essential, because we need not forbid them from eating the
timing also makes a difference. Like during, like I said, before night time and all that, and cleaning before night would be a better option.
I'll tell you a secret remedy that Dr. Krishnamurthy has. He's not sharing it with us, but I'm making it public. The secret for his strong teeth is he writes a poem every day morning, every single day. I've known him for the last 30, 40 years. I think that somehow has some link that some researcher has to find out. I think Ravi is laughing. Even in our Rotary meetings, he used to pen a poem there and then. Very, very interesting. Dr. Arora, you wanted to say something? You have to unmute yourself. We will end this. We have come to the end of our session, 8:15. After this, Dr. Arora's question, we'll end it now.
Dr. Aishwarya, I would like to share with you that research work where I was involved for 20 years earlier. Regeneration of, I'm not a dentist, but we were involved in a multiple way when we were in armed forces. So now that part of the research has completed, and they have identified the enzymes which comes from RNA, DNA, and stem cells for regenerating of tooth. Down the line, 5 to 6 years, you will have that enzyme availability. So tooth broken, it will be regenerated.
Good news.
This is the latest I'm explaining. Second point is there are a lot of issue which is now, research outcomes are there visible. It's basically the microbiomes of the mouth, which is after gut. It's the mouth which has got a high number of microbiomes.
Yes.
Actually, there are 200 billions of them in the mouth.
There are more microorganisms in our body than the cells.
Yes. What is happening now, use of antibiotics is destroying them.
Yes.
Second thing, we are using chemical-based mouthwash, which is damaging them. Then you get periodontal disease and you get spongy teeth. You go for a dental treatment for RCT. In that RCT process, these, secondary organisms which goes into circulation, and they stimulate a chronic inflammation and resulting into Alzheimer. And there is evidence-based study has come out already. So this need we all should understand. That is why I have used that curcumin or haldi or salt, because they prevent inflammation. And you do sponging. Once inflammation is prevented, the chances of getting inflammatory changes going through a microcirculation of a tooth to the brain and cause Alzheimer, which is now evidence-based. There is a large number of studies which have proved this. So it is an important, because Alzheimer is related with when you do intervention with the tooth in all these, RCTs and all those things. So we need to now work out a system where this damage can be prevented.
Yes, sir.
Thank you, Dr. Arora, for sharing that. So thank you so much, Aishwarya. It was a very, very engrossing, I would say, very...
One more small...
Yeah.
Aishwarya, I heard only the last part of your lecture. It was very lucid and very explicit. I congratulate you. Incidentally, I share my second daughter. She's a practicing dental surgeon in California. Then when in 1968 and also during my radiology days, regarding the jaw, my professors used to ask, you remember 3 A's are lesions which affect the jaw, lower jaw, 3 A's. So I am fond of that. A, adamantinoma, actinomycosis, and aneurysmal bone cyst. 3 A's. Probably you can pass on the same quiz to your students also. Remember what are the lesions which start with A and like that. Just a lighter aspect. Anyway, very, very nice.
Thank you. Thank you, Doctor. So Aishwarya, again, it was really nice. Are you able to hear me?
I can, Uncle. I don't know why my screen. I can see
Yours,
everybody.
yeah, your image is frozen. But very
Okay.
nice, and thank you for the effort you put. May I now call upon Dr. Sravya to thank our speaker for the evening?
Yes, I don't want to take up too much time because it's been such a informative and exhaustive, in detail presentation. Thank you so much, Ash, for taking time off from your really busy schedule. So I think for everybody it's been super helpful not to ignore and not to tell your kids or the dentist and wait till the last minute, which everybody does. I've had that experience with my grandparents. So don't wait if you see a black spot, or it could be just an aphthous ulcer, halitosis, a white spot, candidiasis, which you're thinking, it's just fungal. And from taking care of your dentures, I think we've covered everything. Ash, I'm feeling like half a dentist now. So thank you so much. And I hope it was very, very helpful for everyone.
Okay, and just to give you some idea of our forthcoming talks. And before that, thanks, Ravi, for reading the prayer. Nice to have you live on the... Oh, incidentally, I must share this. Some of our members have suggested that I do not share the recording of our meetings, because many people have got into that comfort mode of not participating live. They can see it leisurely later. So there has been a suggestion from a few of our members not to publish the recording. And of course, some good friends of mine come and join late after a vigorous billiards game, hoping that they can see the, entire recording tomorrow. So maybe we'll take a call. The executive committee will meet and discuss it and say, we'll not share the recording. We will have the recording, of course, but maybe we'll share it, as a kind of a library later. But these are interesting talks, and we have a very, very wide range of topics, excellent speakers from all parts of the world. So I think losing a billiards game one day is worth it, to benefit from that. So here are some of the very interesting talks that are coming up, and completely different from today's talk. Next month, we have a biotechnologist who quit his job, set up a petting farm. He is Mr. Nandakishore Reddy, known as Nandu. He has a petting zoo somewhere in the Kompally area, and he's a consultant to the government of Madhya Pradesh to he has set up an aviary in their zoo. So he's going to speak about musings of an aviculturist and his undying love for nature. This is in September. And in October, and this I'm sure most of you would really appreciate, there's this former executive of Sun in the Silicon Valley. He's been in the IT industry. He is 70 years old now, 71. He has taken up a project to retrace the Padayatra that Adi Shankaracharya did hundreds of years ago. He is covering all the 12 Jyotirlingas in India. He has already covered, I think, 2. And he will be covering the third leg in October, and he will be speaking to us on 21st of October. Incidentally, all our meetings are always on the third Saturday evening. So whatever is the date in that particular month, the third Saturday. His name is Vijay Raj Vaidya. He'll join us from San Jose, California, and he'll talk about his project of passion of retracing Adi Shankaracharya's Padayatra hundreds of years later. And in November, we have a gentleman called Murthy Cheruvu, Dr. Murthy Cheruvu from IIT. Then he studied in Italy, England, and US. And he retired as a senior executive from IBM USA. And is a very active volunteer in the Satyasai International Organization of North America. He is going to speak to us on sustainable education through volunteerism and altruism. You can see the very diverse topics that we have. And in December, we have another young doctor. She is actually my school classmate's daughter. She is a pediatric emergency medicine physician in New York Grossman School of Medicine. She volunteered in this organization called Doctors Without Borders, Humanitarian Healthcare. She volunteered to serve in Africa in a couple of instances. So she's going to speak about healthcare in a volunteer mode, not the professional mode. You can see the very diverse range of topics. So why I'm telling you in such detail is, if you are not attending the meeting, or if you still think billiards is more important, you know what you're missing. So let this register and do not miss any of our meetings. And thank you all for coming. Today we exceeded our meeting time by 10 minutes, but we always start at 6:30. So please log in at 6:15 latest. And very nice to have you. All of you have a good weekend. Good night. I'll sign it off now. Bye-bye.